Hello students, this is an introduction to radiographic image interpretation. To interpret means to offer an explanation. The interpretation is an explanation. When we are discussing image interpretation, we are talking about an explanation of what is viewed on a dental image. The ability to read what is revealed by a dental image. A diagnosis, however, is the identification of a disease by examination or analysis. In the dental setting, the dentist is responsible for establishing a diagnosis. Other members of the dental team are restricted by law from rendering a diagnosis. Dental radiographers must be careful to stay within the scope of practice when interpreting dental images. Much information about the teeth and supporting bone is obtained from image interpretation. All dental images must be carefully reviewed and interpreted. Image interpretation is of paramount importance to the dental profession and plays a vital role in the detection of diseases, lesions, and conditions of the teeth and jaws that cannot be identified clinically. The dental hygienists and dentists are taught how to interpret clinically. The dental assistant, however, may or may not be trained. Any dental professional with training in interpretation can examine films. This will involve identification of normal anatomy, dental caries, periodontal disease, and traumatic injuries, as well as periapical lesions. A diagnosis is made by the dentist after a thorough review of the medical history, the dental history, a thorough clinical examination, a thorough radiographic examination, and any necessary clinical or laboratory tests. It is best to have images taken at the beginning of the appointment and interpreted immediately after mounting in the presence of the patient. Suspicious or questionable areas can be examined by the dentist or dental hygienist to obtain additional information or confirm a suspected problem. It is important to remember that images are taken to benefit the treatment of the patient. Images may be also used as an educational tool in the dental setting. The patient may be educated through discussion of normal findings on dental images, and specific problems and areas of concern may be identified. Educating patients using dental images can help everyone work together as a team for the benefit of the patient's health.